Hi, I'm Megan Mel. I'm a student nurse practitioner.
Nice to meet
I'm
you.
going to do your assessment today with your
Okay.
permission.
Absolutely.
Is it okay with you if we film it today?
Yes.
Great. I'm going to wash my hands. Tell me your full name.
Darren Lee Mellon,
Tell me what date today is.
September 11th, 2018.
And tell me why you're here, please.
General assessment of my health.
Are you having any pain?
No.
I'm going to start just to take a look at your skin, and then we'll go through your systems there. I see warm, dry skin, intact. I don't see any lesions or abnormalities. Good skin turgor. I'm looking at your skin, your nails. I see pink nail beds with no ridging to the nails, nice and firm. I don't see any signs of clubbing. I see 160 degrees on the nail bed. Don't see any lesions or asymmetrical notes. The rest of your skin looks the same, warm, dry, intact without any lesions. I'm just going to take a look at your scalp. It's movable. I see hair distributed evenly throughout without any abnormalities. Your skull feels intact without any signs of trauma. Don't see any parasites or lesions. It appears clean. Your face looks symmetrical. I don't see any abnormal facies. Your skin is uniform throughout. I don't see any changes in the skin tone. Your eyebrows are full, extending beyond the temporal canthus. I'm just going to palpate your eyes there. Any pain?
No.
Okay. Could you look up? I'm going to look at your sclera, which is white, with some occasional blood vessels, which is a normal finding. I'm just going to pull down your eyelids. Your sclera are pink, moist, and intact. Now, could you look down for me? Your eyelids, upper eyelids, sclera, pink, moist, and intact. Any tenderness with the tear ducts?
No.
Any tenderness with the lacrimal glands?
No.
I'm going to palpate your sinuses. Tell me if you feel any tenderness. The frontal sinuses, maxillary sinuses, and mastoid process. No tenderness there? Great. Okay. Now I'm going to take a look at your ears. The auricles look symmetrical bilaterally. Landmarks being the helix, the antihelix, the tragus, the antitragus, lobule, the concha, the triangular fossa. Don't feel any differences bilaterally. Skin is the same as the face. I don't see any discharge or foreign objects. I'm going to hold my otoscope and take a look. I'm going to pull your ear up and out. Your tympanic membrane is gray without any signs of redness or bulging. I see some ceramin in the auditory canal. This side looks the same as the other side.
Good.
Okay, great. I'm going to take a look at your eyes now. Could you look at the wall?
Mm-hmm.
Take a look at your pupils. They look equal bilaterally. Irises are equal bilaterally. Taking a look at your corneal reflexes, equal bilaterally. I'm looking at your pupillary response to light. I see equal bilaterally with consensual accommodation. If you could follow my finger, convergence is good. 6 cardinal fields of gaze. Follow my finger, looking for nystagmus. Okay, very good. Now I'm going to check your corneal reflex for the red reflex. Okay. And your cornea is nice and clear. I can see your fundus looks nice and pink. Same on the other side. Good red reflex. Cornea is nice and clear. Okay, I'm going to look at your mouth. Open up. Your buccal mucosa, your tongue, your soft and hard palate are all pink, moist, and intact. I don't see any lesions, thrush, or abnormalities. Put your tongue to the top of your mouth, please, underneath your tongue. I don't see any abnormalities there, any lesions. You have good dentition. I don't see any missing teeth. Can you smile for me, Clint? Your bite is looks like it's all intact there. Could you stick out your tongue? Great, that's testing the cranial nerve 12, the hypoglossal nerve. Say ah.
Ah.
Okay. I see your uvula rises midline. The retropharyngeal area is pink, moist, and intact without any postnasal discharge. I don't see any tonsils.
Right.
Have been removed?
Yes.
Okay, great. I'm going to palpate your nose. I don't feel any displacement of the bone or cartilage. I don't see any outward signs of discharge. I'm going to take a look inside, see if I see any there. No discharge, turbinates moist, pink, and intact. I don't see any deviation of your septum. Great. Okay, I'm going to do a whispering hear test. I want you to close one of your ears. I'm going to walk behind you and whisper, and you tell me what I say.
34.
Great. Switch.
29.
Great. Okay. Now I'm going to take a look at your neck. Could you turn to the left for me? Turn to the right. Tilt your head down, back, and then put your ear to each shoulder. And the other. Any dizziness?
No.
Looks like you have full range of motion there. I'm going to go back and just test your gag reflex. Say ah. Gag reflex present. I need to do it one more time. Say ah. Gag reflex present. Sorry about that.
It's okay.
Okay, I'm taking a look at your neck. I don't see any fullness or abnormal protrusions. Your cardiac carotid artery, I don't see any abnormal prominence there. Trachea appears midline. I'm going to auscultate the carotid artery for any bruits. None noted. I'm going to palpate your trachea to see if it's midline. It feels equal bilaterally. Great. Now I'm just going to take a look at your thyroid. I don't see any abnormal size there. It looks normal. When you swallow, it looks normal. I'm going to have you take a sip of water in your mouth. When I tell you, you may swallow it. I'm going to palpate your thyroid for movability, smoothness. Go ahead and swallow. Okay. I don't feel any I don't feel any enlargement. Was there any tenderness there?
No.
I didn't feel any nodules. Great. Okay, I'm going to feel your lymph nodes. Preauricular is your parotid, your submandibular, submental, sublingual. Tell me if there's any pain here.
Nope.
Or tenderness. Your occipital, your postauricular, your external jugular, your hypopharyngeal and parotids, your anterior cervical chain, your internal jugular chain, your posterior spinal nerve chain, your posterior superficial cervical chain with a deep palpation in the back, and supraclavicular nodes. Okay, I don't see any lymphadenopathy. I don't see any red streaking, any pain when I palpate it.
Nope.
Okay, great. This concludes my assessment.
Thank you.